This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. If you or someone you know has struggled with substance use disorder, where would you go for help? State Senator Saud Anwar recently highlighted the lack of beds to treat patients for substance use at state-run facilities like the Connecticut Valley Hospital and its Blue Hills campus. Today, Where We Live, Senator Anwar joins us to talk about this issue as overdose deaths in our state continue to grow. Data from Kaiser Family Foundation show deaths due to drug overdose in Connecticut nearly doubled from 2015 to 2020. Coming up, we hear from the Wheeler Clinic about the lack of enough outpatient services to meet demand in our state. President and CEO Sabrina Trokey says there are too few clinicians to see patients, which also leads to a backlog. Now, you can join our conversation, 888-720-9677. That's 888-720-WNPR. Share a comment on our Facebook page or find us on Twitter at Where We Live. Joining us first again is Dr. Saud Anwar, who's a state senator, and he's a chair of the Children's Committee, as well as the Public Health, acting chair of the Public Health Committee. Dr. Anwar, Senator Anwar, welcome to the show.
Thank you so much, Lucy, for having me. Thank you.
Now, I mentioned you recently visited Blue Hills and Connecticut Valley to assess the shortage of beds for patients with substance use disorder. What prompted you to visit? What were you hearing?
Well, I had serious concerns because the number of beds that we have are not increasing. The number of staff that we have at the Blue Hills facility for detox have been more or less stagnant. And this is a state-run facility. This takes care of the most vulnerable people in our state. And unfortunately, we have too many beds which are non-functional. And it appears that the pathway and the progress to hiring more staff is not as effective, and it's not showing the results. And it's a crisis situation in our state. And to have a state facility not functional raised deep concerns for me. And I visited them to see firsthand what were the causes.
When we talk about the treatment that they would be getting, tell us more about that and how many people are being rejected for services because of that shortage.
Well, that they claim at this time that they are not getting as many people reach out to them. But if you look at their website, they have no beds available or one bed available every few weeks or so. So even though they have limited number of beds, they are actually far more capacity if we had the staff. And as a result, because on their website or on their phones, when people hear that there's no bed available, they try to go to another facility. And as a result, we don't even know how many of those patients who could get treatment are being missed.
Now, when we think about, the different places people go for help, we're just focusing on some of the state-run facilities, but, you work at Manchester Memorial Hospital, and I understand that even a shortage of beds for patients who are presenting with overdose symptoms, while no one is turned away when they show up at the hospital. Tell us what you're seeing.
Well, as an intensive care unit doctor, I see the truly heartbreaking part of the lack of appropriate treatments. We at times are seeing people coming in with overdoses, with the cardiac arrest, respiratory failure, because some of these medicines make the person stop breathing. So, and many times we've seen individuals who get brain death or actual death as well. And it's heartbreaking because every single one of them are preventable. And the burden of the illness has been increasing over time. Just by the end of the day today, we will lose 4 people in our state to the opioid alone.
And you're seeing repeat visits by some individuals, Senator Anwar?
Yeah, so Lucy, that's the other part of the painful process that we are seeing is when we use substance use disorder, patient goes through the critical care management, they go through all the treatments for many days, and they go through detox. And once they get better, they are well enough, there is not a good place to send them for rehabilitation. Many of the times they're interested to get rehab, but because we don't have enough space or enough coverage for the insurance industry, that results in that individual going back to the community only to return back again. So it's, again, part of our challenge we have is that we need to address this. Otherwise, this revolving door is not healthy for patients or for our healthcare system.
You're hearing State Senator Dr. Saud Anwar, acting chair of the Public Health Committee, also chair of the Children's Committee, as we talk about a shortage of beds at some of the state-run facilities for people with substance use disorder, and what it looks like for those who end up coming to hospital ERs for help, especially if they're overdosing, and what community supports are available. What are some of the barriers to that care? You can join us 888-720-9677 or find us on Facebook and Twitter at Where We Live. Kathy tweeted to us that she was curious, how long are the waits for intake appointments when someone first seeks help? What do you know, Dr. Anwar?
So for the outpatient, it again remains weeks to months before somebody can get treatment. Some of the facilities say that you can walk in and be seen right away. And then there are some of those options, but they are not as many options as the needs are.
Mm. And for those, when we think about how different insurance plans are available, depending on someone's coverage, what's happening there in terms of increasing bed capacity or the incentives to have hospitals do that, to Senator Anwar?
Lucy, this is another area that it needs a lot of opportunity. About 1/3 of the patients who need help, approximately, they get Medicaid, but the rest of them are on commercial insurance. There is a need for payment reform because the lack of payment, lack of coverage is resulting in the facilities not being able to sustain or create more beds. And right now, despite various laws and efforts, we are not seeing the same amount of support and help, financial incentives for facilities to create inpatient as well as outpatient management services for patients.
When we think about the type of information that policymakers are asking insurance companies to provide, the latest 2022 Mental Health Parity and Addiction Equity Act report to Congress, I understand there were 156 letters issued to insurance plans requesting what's called a comparative analysis for non-quantitative treatment details. And that report states none of those analyses reviewed to date contain sufficient information. Then there had to be follow-up, and 26 plans have agreed to now make changes. Producer Sujata Srinivasan also contacted the Connecticut Insurance Department for details, and we received this statement from Jim Carson, quote, "The department found only certain instances where documentation was insufficient to demonstrate 100% compliance." Again, he was referring to this comparative analysis for non-quantitative treatment. So parse that down for us, Senator Anwar, and respond to that for us.
Yes. Look, if somebody goes in with a broken bone, you get the top-notch treatment in our state, you're taken care of, and the insurance industry pays, you get an orthopedic surgeon, take care of it. When you go in with an invisible injury, we do not treat it with the same respect and focus as we do for the visible ones. And as a result, because of the invisible challenges which behavioral health and mental health and substance use disorders have, results in not only the family and the individual not recognizing it, the internal barriers, but the external barriers of the society and the healthcare systems not doing as much. That's the reason the federal government and our state government had put in laws to make sure that there's parity for mental health issues as well as for the same level as for physical health. Unless we put them at the same level and same level of urgency, we are not going to be able to address this. And I'm honored. In 2019, I was a co-sponsor of the bill, which has become a law to try and make sure that every insurance company is having the same level of parity for mental health and behavioral health and substance use. Has been a law in our state and is also a federal law. And just like you alluded to, that is not being followed by the insurance industry the way it is intended to be. And as a result, it leaves many of our patients without the support, without the help that they need.
When we spoke to the Connecticut Insurance Department, it told us it had not received any complaints. Currently, though, in the past, the department has received individual complaints regarding substance use claims, all of which have since been resolved. Because you had mentioned that 2019 law, insurers not complying, what are your next steps, Senator Anwar?
I do think that we have a responsibility legislatively to continue to pursue at multiple levels. One is the education process of the community of their rights about this issue, but also regulation and making sure that the industry is required to follow the law, and then there would be consequences in the absence of such law. Look, the insurance department is following the laws, and they're just expected to take care of that. But we can strengthen the laws even going forward to make sure that the industry is not relaxing on their end of their responsibilities.
Mm. I feel like I've been talking about substance use disorder, the rise in overdose deaths for some time now, long before the pandemic. Dr. Anwar, when you see those numbers increasing, still having these conversations about whether there's lack of staff to help people or a shortage of hospital beds, it must be very frustrating for you, your first job being a medical doctor.
It is heartbreaking because the deaths that I'm talking about, many of those individuals have died with me providing them care. And I'm the one at times holding the hands of the loved ones who are left and wondering what happened. And the grief that encounters and the potential of each individual, they are capable of having a complete, full, perfect life. And this is why at times to my students, the residents and medical students, I say that this is not an illness of an individual. It's the illness of our society for not being able to prevent this, not being able to identify this, and not being able to treat this. And as a result, we are losing some of the young people or older individuals to some of these preventable conditions. So this is an urgent issue. We have lost about over 1,500 people in the last year, and each one of them was a preventable death. And we owe it to make sure that we can work hard and then work smart to prevent each and every one that we can prevent from going in that direction.
Again, you're hearing State Senator Dr. Saud Anwar, Acting Chair of the Public Health Committee, Chair of the Children's Committee, as we talk about supports for those struggling with substance use disorder. Coming up, we're going to hear more about the community supports in place. Not everyone needs inpatient treatment. So what are the outpatient resources out there? Our number, 888-720-9677. And I wanted to just give out this number for people who are looking for help, whether it's an assessment center, maybe medication-assisted treatment, or MAT. We'll hear more about that coming up. There's and residential treatment as well as detox. There's something called an access line. It prioritizes transportation services for detox and also arranging transportation for DMIS, substance use disorder, residential treatment. Here's the number, 1-800-563-4086. Again, 1-800-563-4086. We'll be back, and we're going to be hearing from Wheeler after this short break. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Today we're talking about the lack of hospital beds for the treatment of substance use disorder in our state, also efforts to reduce repeat ER visits for overdose. With us on Zoom is State Senator Dr. Saud Anwar. And joining us now on the phone is Sabrina Trokey, who's President and CEO of Wheeler. Sabrina, welcome to the show.
Good morning. Thank you for having me.
I had mentioned before the break, not everyone requires inpatient care, and so I'm wondering if you can briefly remind our listeners about Wheeler and the services you provide.
Sure. Wheeler is a nonprofit community organization that provides comprehensive primary care, behavioral health, substance abuse child welfare, early childhood, and wellness recovery services for children, adolescents, and adults across Connecticut. We annually serve over 50,000 children, adults, and families through our community health and wellness centers, which are located in Hartford, New Britain, Waterbury, Bristol, and Plainville. We offer integrated primary care and behavioral health services, including outpatient, intensive outpatient, psychiatric supports, and medication-assisted treatments for substance use disorders.
Mm. Thank you, Sabrina. And you mentioned medication-assisted treatment, or MAT. I think that's what it's known as. And so that's an outpatient service. You know, there is an issue there when people are trying to seek help, and maybe this is the route that they're going. It's evidence-based, but that requires a prescription, I believe, from a psychiatrist. And so what are people experiencing because of that?
So it requires a prescription from a medical provider, and the issue we're currently facing, and it's a national workforce crisis issue, is related to access to psychiatrists, to medical providers, to clinical clinicians. So at a time where we're seeing an increased dramatic need for these services, we're facing an unprecedented workforce crisis at the same time. And so, just speaking for Wheeler, over the last 12 months, we've seen over a 25% increase in patients presenting for behavioral health and addiction services. During that time, we're probably anywhere from 18 to 10%, depending on the time period, understaffed. And those are critical psychiatric positions, medical positions, and behavioral health clinical positions that we are struggling to fill and to keep staff within those positions.
That sounds really troubling. When I talked about medication-assisted treatment or MAT, your staff is trained for that. So people that are looking for that don't need to rely on a psychiatrist to give them a prescription. But you mentioned there's a staff shortage, and so that plays a part in potential delays, Sabrina?
It does play it does have a role in being able to offer immediate access. We do at Wheeler, because we are an integrated primary care and behavioral health provider. We're fortunate that in addition to psychiatrists, we have family practice medical providers. We have advanced practice nurses in family medicine and in psychiatry to be able to ensure that that we can meet the demand for medication-assisted treatments. So within our system, regardless if you're a primary care provider, a psychiatric provider, you must be credentialed and certified and have the certification to be able to prescribe the medication-assisted treatments like buprenorphine and Suboxone and Vivitrol. And that provides us more. That does provide us more staffing resources to be able to meet patients when they present, and that's the most critical piece. When an individual presents for care, we can't turn them away. We need to see that patient. We need to begin the medications that day, because we know if we don't begin the patient on the needed medications today, the likelihood of that patient going back into the community, back into the streets, and using illicit substances is very high.
Right. State Senator Saud Anwar is still with us. When we hear Sabrina talk about the shortages that they're experiencing at these outpatient centers, Senator Anwar, there was that package of bills signed into law that addresses the mental health crisis, including, I believe, efforts to bring out-of-state clinicians to our state. Can you talk about that, Senator Anwar?
Yes, and I do want to thank the work that everybody does at Wheeler Clinic under your leadership as well. But I just want to mention the fact that we got to this point where workforce decided to move to other areas because this is a tough industry. And when there is not enough support and financial benefits to people who are doing hard work, they move on to other areas. And what we have tried to do as a state this time in our bills, which include the House Bill 5001 and Senate Bill 2 and partially Senate Bill 1, to actually have incentives for individuals to move into these careers. So we needed to have a long-term strategy. The long-term strategy is to give incentives to our young individuals or people who are looking at second careers to have benefits and support if they move towards becoming a specialist in behavioral health and mental health issues, but substance use related management at the entire spectrum, including psychiatrists, psychologists, licensed social workers, and all the support that goes along with that. So that's something that's very important, but also in the interim, because we need help right away, we have made sure that there is opportunity for personnel from other states to have the same level of licensing, where we would be able to allow them to work in our state remotely or in person. And that's the reciprocity agreements that we are working on. And these were part of our bills that are going to help begin to help to get the workforce for our facilities like Wheeler Health as well, Wheeler Clinic.
When you mentioned incentives, something that that I wanted to highlight was also loan forgiveness for behavioral health providers. So when you're talking about young people going into this field, Senator Anwar, that will certainly help.
Absolutely. I think the cost of higher education is a barrier for people making choices. And if we were to become partner, as a state has become a partner along with the federal government to provide loan forgiveness, we are hoping that incentive would make people come more towards this field and help out. And it's very rewarding because not only financially, but the emotional reward of changing the trajectory of somebody's care, somebody's health, somebody's well-being, and saving that life is really worthwhile for people to seriously consider this.
Again, you can join us 888-720-9677 or find us on Facebook and Twitter at Where We Live. Sabrina Trokey still with us, President and CEO of Wheeler. Sabrina, I wanted you to respond to these new laws in place to help behavioral health, especially when you outlined, the shortages in staff to provide this care.
We are absolutely thankful for Senator Anwar and all of the efforts that took place in this last legislative session. We do believe many of these pieces will be very helpful as we continue to address the workforce issues. One of the pieces, though, that we continue to struggle with is, in order to engage and to recruit the workforce, we need to be able to provide competitive wages and benefits. And many nonprofit organizations heavily rely on state reimbursements in order for that to happen. And so, while we're addressing some of the opportunities to recruit and to try to keep folks in Connecticut, I also think we need to start to look at some of our reimbursements for these services, because in order to ensure we can recruit, we're going to have to be able to take those steps. And, I've had a number of staff who, because of the burnout, so as we worked throughout the pandemic, we were in person, and so a number of our staff were burned out, and they've completely left the behavioral health or health arena and have gone into private sector work where potentially the pay is more for less complex and less stressful type of work. And so we do need to think about what we can continue to do to ensure that we can keep our staff.
Thank you for explaining that, Sabrina. Kathy had tweeted earlier as well about, why we still have a system that's set up only to manage crises. Can you respond to that?
So I would say that there are a number of processes in place to try to intervene earlier. One of those is the access line. So the substance abuse access line is available not only to individuals seeking care, but available to family members, friends, loved ones who may think that who may have a sense that something is wrong with a loved one, but doesn't know what steps they should take. And so we try to encourage folks to utilize that line to gather information and to be able to understand what you can do to intervene earlier and how to connect individuals to the services and supports they need within their communities. So there are a number of those pieces. I know there are also community crisis intervention programs that once again try to intervene earlier with individuals who may be exposing signs and symptoms of behavioral health, of substance use, and how do we get them connected to services earlier. But I do agree we need to continue to focus on further investments in earlier prevention, earlier intervention services.
Senator Anwar, I'm sure you also have an answer to that question about a system set up to manage crises.
Yes, I think one of the part of our bill that we worked on was having a 24-hour across the state coverage for mobile crisis units. And this is more focused on the children and adolescents, but the 211 system is the way to access the services. It is very simple. We do have individuals who are the operators available have increased. The focus on this area is much more. The waiting time is less. And with those investments, literally 24/7 coverage across the state is something that is going to help people get into the system and get hooked with a existing professional organization like the Wheeler Clinic and others who are actually providing the care. So that is the entry point for individuals who are not yet in the system. And I feel that that's one way to get it. And we also want to make sure that the primary cares, the pediatricians, their offices will have social work support and then try to connect them with the psychiatry services so that there is no wrong door for people to overcome the stigma and the internal and external barriers and recognize that this is part of life and this is something that can be treated. And then having and asking for help is very important, and then seek that help, and the state is getting better to provide that help.
You mentioned primary care. This question's for Sabrina Trokey at Wheeler. Dan tweeted that family physicians are also able to prescribe medication-assisted treatment, or MAT. And like other medical concerns, your first stop can be your own trusted family doctor. Can you weigh in there?
Sure. In order, any physician is able to obtain the waiver, the federal waiver that is needed to prescribe buprenorphine, Suboxone. And what we often find is that when you look up the registry in Connecticut, there are quite a few doctors who have obtained the federal waiver. And then when you look at how many are practicing and prescribing, that number does reduce. And within our system, our physicians, our APRN providers, medical providers are comfortable in prescribing because we have an integrated team approach. So we have psychiatrists on our team, we have the medical providers, we have clinicians, we have peer support specialists, we have nurses and medical assistants. So there is a team supporting the patient, and it's not just the medical provider working individually with the patient. And I think that really does make a difference because our patients with medication-assisted treatments need many other supports in addition to the access to the medication itself.
Again, you can join us, 888-720-9677, as we talk about treatments available for Connecticut residents who are dealing with substance use disorder. Again, with us, Sabrina Trokey, President and CEO of Wheeler. Also, State Senator Saud Anwar is here. One other question from Kathy when she'd asked about, Sabrina, what about non-medically oriented approaches? How do you answer that type of question?
So for addiction treatment, there are many paths, And we have patients who medication-assisted treatments, in addition to the clinical behavioral health supports, is what they need to attain and sustain their recovery. We have other individuals that work with us through our intensive outpatient programming, our outpatient programming, and sustain recovery without the medications. So it's an individualized treatment. Medication-assisted treatments do work. And they work for individuals, and then there's other individuals who choose a different path to recovery. And we support individuals in making that determination and that decision.
Senator Anwar, as we know, you're working to build community capacity, but I understand that you plan to introduce a New York model for harm reduction. Can you tell us about that?
Yes, New York has become one of the first parts in the country for a harm reduction strategy. It is just recognizing that there is an opportunity for safe injection sites. The 1,500 people who had died, if we go back and say, how were some of those deaths preventable? The 4 people who are going to die in our state, can we prevent those deaths? And the answer to that is yes, you can, by a very pragmatic common sense approach. What you say is, don't use your drugs in your home alone or in a corner of a street alone. You can actually go to a safe site where you will be supervised. Nobody's going to judge you. You come and get your injection. And if the dose is higher, we will try and protect you and take care of you. This has worked in Europe. This has worked in Canada. And in the last 6 months, when it was open in the New York city of New York, they have seen 1,300 patients and some 22,000 or so episodes. And I had a meeting with them, and just 5 individuals needed help from EMS of 5 episodes. And many of those, in the absence of this, would have died. And so this is an area where there's an opportunity to save lives and hopefully open the door as they go through their challenges and opportunities, and then we can figure out a rehab plan at some stage. But this is something that we have to really seek some more insight and then educate the community about the value of this.
That data is important, but this has come up before, I believe, in our state, especially from advocates who work with people with substance use disorder. That approach is also controversial. So how do you get your colleagues on board with this idea, Senator Anwar?
I think it's education, but also, look, we are not going to be the first one to ever approach this. This is there's robust data coming out of parts of Europe. There's data that's coming out of Canada, and there's now data coming out of New York. And there is no evidence to support that it's increasing the drug use. It is just there's evidence to support that we are saving lives. And if the goal of our society is to save lives and prevent death, then people will get on board. And the next step is going to be, does that increase the likelihood of those individuals seeking support for rehabilitation? The answer to that is likely yes. And that would also open the door for future opportunity. Look, people are going through a disease. If you look at the substance use disorder and the impact of this, there are so many ways we can prevent death and help take care of them. This is just one avenue that has been missing, but it does not mean that the entire spectrum of other treatments are going to go away. That's why I think it's something that we should all look at seriously as well.
Again, that's State Senator Saud Anwar, who's also a medical doctor, here with us on the show, acting chair of the Public Health Committee and chair of the Children's Committee. He's going to stay with us, but I want to thank Sabrina Trokey for joining us, President and CEO of Wheeler. Thank you, Sabrina, for your time today.
Thank you.
You're listening to Where We Live on Connecticut Public Radio. Coming up, we're going to get an update on how children's hospitals are responding to the pediatric mental health crisis and a shortage of inpatient beds to help them. Also, what are the community supports? More after a break. You can join us too, 888-720-9677, or find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Now, a shortage of beds to treat Connecticut children in a mental health crisis has been an issue long before the pandemic. The problem grew worse over the last 2 years. Connecticut child advocate Sarah Egan told us recently Connecticut Children's in Hartford has a dozen beds, but at times they had 50 children in its emergency department. And Connecticut Children's Hospital plans a new medical psychiatric care unit with increased bed capacity. Overcapacity has also been an issue at Yale Children's Hospital. For more, joining us now on Zoom is Cynthia Sparer, Executive Director of Yale New Haven Children's Hospital. Cynthia, welcome to the show.
Thank you for having me. Glad to be with you.
So when we think about the emergency department at Yale Children's Hospital, also inpatient beds for children in a mental health crisis, what do you have available and what have you seen in the last 2 years?
Yeah, so I think you've framed it exactly right. There is a long-standing commitment at our institution to a full range of child and adolescent psychiatric facility, and we are fortunate that we have 40 beds dedicated to children and adolescents here, and the problems with pediatric behavioral health certainly predate the pandemic. However, this has really created what some call a second pandemic, and that is what we're seeing in behavioral health. And the result is that while we have always, from time to time, struggled with our managing our beds and making sure that we're creating appropriate access to the needs of children and adolescents requiring inpatient care, what has occurred as a result of COVID is that the surge in the amount of children who really are experiencing serious behavioral health crises has produced not only a filling up of those 40 beds that we have, but the overflow into our emergency department, which on many days is seeing 5, 10, 15, and more children in addition to the beds that we have filled. So it really has created an enormous challenge for the families, for the children, and for our team here, our dedicated staff, our psychiatrists, psychologists, social workers, really trying to manage this crisis.
Mm. When we think about the season right now, kids are getting out of school. I understand normally would there be a less or fewer patients coming in? What are you seeing now, Cynthia?
Yeah, so there has traditionally, again, pre-pandemic, been a seasonality to the peaks in demand for crisis intervention and ultimately admission to the hospital for those children that require it. And normally it would occur in the fall when the kids come back to school. There are lots of issues that get triggered as schools reopen in the fall. And so we would see a surge in the fall. And then you see it again in the spring. That is not the pattern now. And so while many schools are now out, and others are, the warm weather is here, kids get outside, we're still seeing our beds full and our emergency department filled with children who we're housing in the ED who need access to inpatient care. So the seasonality pre-COVID that pattern is no longer continuing. And in fact, we're continuing to see those children in our emergency department in addition to those who are in our beds.
You'd mentioned the 40 bed capacity. And so if a child, again, is at the hospital in crisis, what is the typical wait time for those who need to be hospitalized?
That can range in some cases hours and in some cases days. And in some cases it can extend beyond a week. And that is really the reality. Now, some of that is influenced. Sometimes we've had COVID positive children who cannot be introduced into the inpatient environment because of infection prevention reasons. But in other cases, it's simply there is not an available bed to place them. And we do segment our younger children from our adolescents. So we want to make sure that the environment is appropriate for the age. And that's another challenge. We can't take 7 and 8 and 9-year-olds and put even with 14 and 15-year-olds. The needs are very different. The group activities are very different. So there's a lot to consider in how we utilize inpatient bed capacity. But when they wind up in the emergency department, it's really not an environment that is best for these children who need care. So I really think that the conversation we've been having this morning about we need to balance both what's going on within our hospital facilities with what the care and access to the care as early as possible in the community. And so it's really looking at that continuum that's critical.
So you don't have plans to increase beds, but you're saying more investment needs to be allocated towards community support so that children aren't getting to this crisis point, Cynthia?
I think it's working both ends of it. You're exactly right. There is the front end, if you will, and I really agree with the conversation we've been having this morning about working with community pediatricians, with primary care clinics and other providers of primary care to really flag situations early and get children and families the care that they need as early as possible, and helping to support pediatricians, support primary care clinics to be able to have access to, first of all, to identify and then to get those resources available, be they social work, psychology, and other important resources. So I think that's the front end. At the back end, we wind up at times we'll have the beds, but sometimes our beds are not being used most efficiently because we wind up with discharge problems. So simply adding beds doesn't really allow for appropriate management of the continuum. If we have children who are ready to come out of the hospital, but either need community resources in order to manage them safely at home, or for those children who have longer term care needs, really needing something other than an acute environment to be able to provide the long-term care that they require. Mm-hmm. So it's not only having the beds, but using them most efficiently that is a challenge.
When we think about the community pediatricians, the community supports that you mentioned, for children who need outpatient care, do insurance plans cover it, Cynthia?
So that is a very important question you're asking, and the answer is it's highly variable. About 52% of our children are Medicaid insured, so Medicaid plays a critical role. And then among commercial insurers, there is such variation in what gets covered, from zero to very reasonable coverage. So it is highly variable, and that's a challenge for our clinical teams as well as the resources in the community, because people don't want to treat children and adolescents differently based on their payer status, and so it is a real issue.
State Senator Saud Anwar is still with us, who's chair of the Children's Committee. So time to apply more pressure on the insurance companies, Senator Anwar?
Yeah, absolutely. And I can tell you that what we had seen or experienced as a state during the pandemic with the children in the emergency room, I can tell you the entire legislature, the governor's office, took that as a very, very important, serious issue in our state. And we had worked hard to put some $300 million to try and have a comprehensive strategy going forward as a state, to look at workforce issue, to look at how we can have a payment reform, and also look at the gaps that Cynthia has talked about in the outpatient setting, along with Sabrina had touched on as well. Now, the insurance part, we've actually asked for a study to look at the parity. And as a Medicaid, we have been pushing for Medicaid to increase their reimbursement as well for the services compared to where they were before, and have a long-term plan, because if we stop focusing on sustainability of support, in other words, paying appropriate amount to the people for the work that they're doing, we are not going to be able to solve this long term. And these are all our priority. And the work with insurance companies always partially done, and we have more to do.
Before we ran out of time, we had a caller from Southington, Don, who wanted to touch on our previous segment, Senator Anwar, talking about the shortage for behavioral health clinicians and others in our state, incentives to help boost that workforce. His question, what's being done with national licensure? Difficult to move given different requirements state to state. Anything being done about a national license that could make it easier for providers to move and work in different states? What can you tell them?
Sure. With respect to the reciprocity agreements across states, because the licensure is always done through the state. So that's why, but if you look at the number of states who are working collaboratively, we are moving in that direction. We have not reached that, and that will require a federal law to reach that. But with respect to this particular issue, literally there are multiple different states in our neighborhood, but beyond, who are saying that the Connecticut license is going to be acceptable to them and vice versa. And so we have stepped in that direction, but it's in 20 to 30 other states rather than all 50 states right now. But that's a federal bill, and maybe we'll get to that point.
If I could just piggyback on that. So I serve on the Public Policy Committee for the Children's Hospital Association. Could not agree more with Dr. Anwar. And it's something that we are spending a great deal of time on a national basis among children's hospitals to advocate for exactly what he's just described. I think the question being asked by your caller is a very important one. And so I couldn't agree more that we need to work on this both within the state, but also as a national issue, and it is an important policy issue. I think the other thing I would just want to add is that, going back to the community, is that a lot of our work right now is also trying to look at the primary care being provided to children and having embedded behavioral health in those primary care practices. And we do have some wonderful collaborations with two of our federally qualified health center partners where we're doing just that. So I think there is an opportunity not to think of behavioral health as a segmented part of healthcare delivery, but actually an integrated part with the prevention, primary care, and behavioral care all being provided in a holistic way. And I think we have lots of opportunity to continue to advance that work as well.
You've been hearing Cynthia Sparer here on Where We Live, Executive Director of Yale New Haven Children's Hospital. Cynthia, thank you for your time today.
Thank you.
Also with us, State Senator Saud Anwar, Acting Chair of the Public Health Committee and Chair of the Children's Committee. Thank you for your perspective as always, Senator.
Thank you so much. Thank you for having me.
I'm Lucy Nalpathanchel. Today's show produced by Sujatha Srinivasan. Katie Tolarski was our technical director. Tomorrow we'll be back with a show about youth sports. We hope you join us.